Good morning, all. Today, I would like to discuss about the topic blood transfusion. So, first, we are going to discuss about the definition of blood transfusion. So, a blood transfusion is a medical procedure in which blood or blood components such as red blood cells, plasma, platelets, or cryoprecipitate are transferred from one person, the donor, into the bloodstream of another person, the recipient, through a venous route. It is commonly used to replace lost component of the blood due to surgery, injury, diseases, or medical condition that affect blood production. That's the definition of blood transfusion. So in blood transfusion, we are transfusing the blood components such as red blood cells, plasma, platelet, or cryoprecipitate. Okay, that's the definition of blood transfusion. Then next one is common indications for blood transfusion. So we already said that we are transfusing some components of blood. So first we are going to discuss about the PRBC transfusion. That is red blood cell transfusion. So commonly the red blood cell transfusions are done for anemia and blood loss. So in anemia, the hemoglobin level for women is below 12 and for men is below 13 are considered anemic. So the normal range of hemoglobin in men is 14 to 80 gram per deciliter and in female is 12 to 16 gram per deciliter. So if the hemoglobin is less than 7 gram per deciliter and the patient is stable and non-cardiac. So the patient is a non-cardiac patient and the patient is stable but the hemoglobin level is less than 7 gram per deciliter when we need to transfuse PRBC. So the second case is if the hemoglobin is less than 8 gram per deciliter and the patient is a cardiac patient or patient have an active bleeding or patient is undergone a major surgery. Such patients, if the hemoglobin level is less than 8 gram per deciliter, then we need to transfuse PRBC. Then the next case is if the hemoglobin level is in between 8 to 10 gram per deciliter and the patient is symptomatic, which means if the patient has some symptoms like chest pain, dyspnea, hypotension, tachycardia, then we need to transfuse PRBC in such cases. So the other case is acute blood loss. So the acute blood loss is the estimated blood loss is greater than 30% of the blood volume. So the normal total blood volume of the body is 5 liter. So if there is a blood loss greater than 1500 milliliter, then we need to transfuse blood components, that is PRBC in that cases. So maybe it's due to some surgery, there is a heavy blood loss or some traumas, so we need to transfuse. If the blood loss is greater than 30% of the total blood volume, so we need to transfuse blood in that cases. So that is why in some major surgeries like cardiac surgeries or any other cesarean section or neurosurgeries, we will arrange PRBC prior to the surgery. So if there is a blood loss greater than 30%, we need to transfuse that blood post-operatively to the patient. So then next is unit of packed blood cells, that PRBC raises hemoglobin. So 1 unit of packed blood cell that raises a hemoglobin of approximately 1 gram per deciliter in an average adult who has a weight of approximately 70 kg. So a patient is 70 kg weight approximately, then 1 unit PRBC is raising a hemoglobin of 1 gram per deciliter and also raises a hematocrit of 3%. So the second thing is platelet transfusion. So in platelet transfusion, we are transfusing RDP or SDP. So the reason is if the patient is having thrombocytopenia or platelet dysfunction. So the normal range of platelets is 1.5 lakh to 4.5 lakh. So in thrombocytopenia, the platelet count is less than 1.4 lakh. So in cases like if the patient platelet count is less than 10,000, so we have to and the patient is stable. So if prophylactically we have to start RDP for this patient. Then if the patient platelet count is less than 20,000, And if there is a risk of bleeding, then we have to start RDP for these patients. And if the patient platelet count is less than 50,000 and the patient is planned for a surgery or invasive procedure such as lumbar puncture or central line insertion or some invasive procedure, so we have to start an RDP prior to that procedure. Or any count with an active bleeding and non-platelet dysfunction. So if the patient with an active bleeding or a non-platelet dysfunction, so the count is not an important factor there. So we need to transfuse RDP in that cases. So 1 unit of RDP typically raises platelet count by 5,000 to 10,000. And SDP, and what is the difference between RDP and SDP? RDP is a random donor platelet and SDP is single donor platelet. So the SDP may be referred when a repeated transfusions are needed to reduce the alloimmunization risk. So if there is a repeated transfusion is needed, there is a chance of getting reactions or alloimmunization. So to reduce that risk, we are transfusing single donor platelet for such patients. So next thing is fresh frozen plasma or FFP. So the FFP is commonly transfused for coagulation factor deficiencies. So the coagulation factor deficiency, the normal INR ratio is 0.8 to 1.2. So the normal INR ratio is 0.8 to 1.2. If the INR ratio is greater than 1.5 to 2 with the bleeding or before surgery, we have to transfuse FFP in that cases. So if the INR in between greater than 1.5 to 2.0 with the bleeding or the patient is planned for any procedure, first of all, we need to transfuse FFP to normalize this INR ratio. So next thing is massive transfusion protocol. So what is massive transfusion protocol? Which means if the patient is in trauma and there is a high blood loss and we need to transfuse 10 or more unit of PRBC within 24 hours, that is called massive transfusion protocol. So in that case, if there is a ratio of 1 is to 1 is to 1, that is PRBC is to FFP is to plasma. So to mimic the whole blood component along with the PRBC, we need to transfuse FFP. That is in massive transfusion protocol, we need to transfuse FFP to prevent coagulopathies. So in liver disease, we all know that the liver are producing most of the coagulation factors, clotting factors. So in liver diseases, we need to transfuse fresh frozen plasma, and in DIC, that is disseminated intravascular coagulopathies, so we have to, and other coagulopathies, we have to, or active bleeding, we have to transfuse fresh frozen plasma in order to prevent bleeding. A typical dose of FFP is 10 to 50 ml per kg of body weight. So a typical dose FFP is calculated using 10 to 15 ml per kg of body weight. So usually an average adult needed 3 to 4 unit is needed for an average adult at a time. So 3 to 4 FFP is needed for an average adult at a time. Then next is next and the final one is cryoprecipitate. The cryoprecipitate is for fibrinogen replacement. So the normal fibrinogen level is 100 milligram per deciliter to 200 milligram per deciliter. If the fibrinogen is less than 100 milligram per deciliter with the bleeding DIC or massive transfusion or hypofibrinogenemia, so then we need to transfuse cryoprecipitate. Okay, thank you.